This is my favorite topic to discuss, upper cervical instability. When we talk about upper cervical instability, we want to be super clear on some details. So what we are going to talk about is the C0 to C2 area in the upper neck cervical spine. The C0 being the base of the skull, which we call the occiput, and then down to the C2 vertebra. But what we want to do is then we want to emphasize, okay? So we want to emphasize the C1, okay? Why? Just because the C1 is what tends to be the most impactful, and so we are going to emphasize the C1. So now we want to look at the structure of what happens when we get to upper cervical instability. So there's something that happens before that, and we want to look at what we call a C1 syndrome. It's a catch-all diagnosis because sometimes we don't know if somebody has instability. So we know that up here, because the C1, if it's affected, then it has the ability to affect an array of structures because of its neurological effect. So that's what we term a C1 syndrome. Now, what happens is then the C1 syndrome, once we know more about what's going on, branches off into C1 dysfunction, or where there is just a misalignment, or C1 instability, okay? So now what you see below that is that, well, just so happens that so many of the symptoms, now this is of course a small list of the symptoms, but the list of symptoms can be the same. So what is the difference? When we look at the C1 dysfunction, we have stability here. When we look at the C1 instability, right, the upper cervical instability, right, we have instability. So what then is the difference that's going to cause these familiar symptoms? The difference and the definition and what is going on is actually ligament laxity. So what is upper cervical instability? That is simply just ligament laxity in the upper cervical spine. It is the only difference between the two. That means the ligaments that hold those joints in place have lost their integrity. And that is super important to understand. What is the difference between the two? Not the severity, not the symptoms, but the stability or instability based on only one factor, and that is the ligament laxity. Beyond that, it is extremely important to understand is that there are three major types of ligament laxity. Not one, three. That's where we get into a lot of trouble. I'm going to cover those three major types of ligament laxity in a couple videos to come. So this is why with ligament laxity, no exercise or adjustments can fix it. It is ligament laxity. You cannot strengthen with exercise those ligaments better. You can't adjust it. So we want to be very clear with understanding upper cervical instability to say, yes, that is ligament laxity. There's three types. That is how we treat the upper cervical instability and understand where it lies. I have had patients come in and swear to me they have instability, but you know where they landed? Here. Because they could sustain treatments and sustain the adjustments. But over here, that is where patients don't respond or they don't sustain the treatments and adjustments, which hence then we need to treat the ligament laxity to then relieve the symptoms.